In this video, I'm going to be talking about polishing and polishing techniques. First, I'm going to go into our tray setup. So here I have our air water syringe tip. I have our Explorer, our intraoral mouth mirror, cotton pliers. I have some 2x2 gauze. I have our prophy paste, a disposable prophy cup, floss, a saliva ejector. I also am going to do another video and talk about fluoride, and then our hygiene handpiece. You can also use a slow speed if that's what your office prefers. So when polishing, it's always important that you have a fulcrum. That fulcrum is going to be a finger rest that's used for stability. You always want to use it so that way you're not accidentally like going down the patient's throat, hitting them. It's just a good focal point for you to have. Another important tip when polishing is you want to stay on the tooth for roughly about 3 seconds. If you stay on the tooth too long, because there's no water that shoots out of this, it heats up the tooth. If you heat up the tooth, what that can do is cause nerve damage. It could cause a patient to get a root canal, all the extra stuff that we don't want. You're going to put your prophy paste in here. You should be refilling your cup every two to three teeth, I would say, with your prophy paste. A lot of people like to swipe the prophy paste on and then go through and polish, or some people like to just polish per normal. Whatever you do is your preference. So when we're polishing, one of the ways that I like to do it is I like to swipe the distal, the direct, and the mesial of the buccal facial side of the tooth first. So I like to start on the distal of my last molar that the patient has. So usually I start from upper right to upper left, drop down and go lower left to lower right. Once again, I swipe the distal of the tooth, the direct of the tooth, and then the mesial of that tooth. And you'll see here how that cup kind of flares. You don't want to push too hard to where you're actually, really forcefully doing it, but enough to where you're actually going to create some form of flare in your prophy cup. A lot of people I also have seen like to use the scallop method, which is where you start from one side of the tooth and scallop all the way around, and then you just swipe somewhat in the middle, kind of in the direct of that tooth, to get the parts that it misses when you scallop. So to scallop, you will start on one end, work your way all the way around, come down, and then swipe for that middle part. An important tip is that you never want to work up towards the gums of the tooth, but you want to start at that gingival margin right there, right at that cervical area, and brush or prophy downwards towards that incisal or occlusal. You don't want to shove that bacteria up. You want to push it down and away and off of that tooth.